Welcome, Dr. Tejas.
Thank
All
you, sir.
India rank 128 in UPSC CSE 2023. Congratulations on behalf of UPSC MEDICO.
Thank you so much, sir.
So, how are you feeling right now? And just brief about introduction. Who is Dr. Tejas? Yeah.
Sir, I'm very calm and very happy and feeling privileged to be finally a part of the list after a long time. My basic graduation of MBBS has happened in Seth GS Medical College, associated with KEM Hospital in Mumbai. It's a government hospital, sir. In 2020, I passed out from KEM Hospital, and I took some time to complete my internship because simultaneously I had started to prepare for the UPSC Civil Services. So initially, which internship should have finished by 2020, I finished it in 2021 half. But I think that is my brief
This was
intro, sir.
the during COVID period, right? 2021.
Yes, sir.
Like, is it possible for any student if is like from medical science background, if he wish to uh, postpone the internship, then give an attempt, then after securing a rank, can he come back and finish off the internship? Like, will they allow it?
Ye- Yes, sir. The only caveat in that is one has to produce internship completion certificate by the time of appearing for the interview. So if we have like just 1 or 2 months of internship left, and that can be managed pretty well after giving the mains examination. But if it is too much, like 6, 7, 8 months, then it will not be possible.
Like once you secure a rank, I think you can speak to the superintendent of the hospital, or definitely they will give you a privilege. You can either come back and finish off your internship. There are many ways wherein you can get an internship certificate. So let's not get into that mode. But definitely, if you're very serious about first attempt and if you want to postpone few months, like 2 to 3 months of the internship, you can take the chance in that. And yes, what was that flare like? Why were you planning to give UPSC in 2020 itself during your internship? What was that catalyst which pushed you towards UPSC?
So the decision was more or less made during the final year, and I had almost 1 year to prepare for myself during the internship. Like in 2019, I had started to prepare, and I was giving the attempt of 2020. So I had almost 1 year. And by the time the prelims examination came, I was more or less confident that I can deal with at least prelims. Mains was a different ball game at that point of time. So I thought ki I'm more or less prepared. Let us give our first attempt. And uh, I was more or less studious and topper of my class, my school, and also I thought, okay, UPSC is also a similar ball game. I'll be able to crack it.
Yes. Like with this 4 attempts, this experience of 4 attempts. Now, if I ask you, how will you differentiate MBBS journey from a UPSC learning journey? What are the key differences you have noted?
Yes, sir. So during MBBS, the university examinations are basically a cakewalk. It is not even a very, it's not basically a competitive examination. The last competitive examination that we have faced is either AIPMT or the state CET. And I do not think that the level of competition of these examinations is at the same level of UPSC. Surely the numbers are not the same. Secondly, sir, the uh, exam is just 1 day exam in case of CET and AIPMT. In this case, it is not just a 1 day examination, it tests 17 different qualities beyond knowledge, temperament, patience, etc. etc. Because the exam is just 1 year long. And beyond that, sir, I think this in itself is a big game changer for me. It's just not that 1 day you are good and you will sail through for the next 5 years. You have to be really consistent. So
As you were saying about the university exams, even we have next coming up. If you are still in touch with what is happening with the medical fraternity, the problem with next nowadays is they're even removing the third MBBS and final MBBS theory exams, and they're making it an MCQ exam of 1 day, as we said. So not even acute. Now it's an hyper acute rejection for our students in the long run if they wish to go for UPSC. So they lose that practice of answer writing. So I think it's very important for aspirants to make a note of this thing that MBBS way of answer writing is little bit different from UPSC, and the exam pattern is also more of chronic in nature, insidious in onset, they say, right? So it takes time. So talk us through your journey from you started in July 2022 and you're a ranker of 2023 UPSC CSE. And one more thing is, when I say 3 years, I say most of the students were confused because we do need PG preparation for 6 months. Then we give an exam. In 2 months, we join it. UPSC is not like that, right? It runs in a cycle of 18 to 24 months. So even Dr. Tejas is now ready with his next attempt. By the time the results come, you should also be ready for the next attempt. So that will definitely take a toll on you, right? So just talk us through your journey of UPSC from 2020. Yeah.
So I had never tested particularly failure in my life. So the first failure came in form of UPSC mains examination rejection, to which I was not that surprised, but I took it like, okay, failures are a part of life. Let us move ahead. But my key mistake was I did not work on my mistakes. So the only improvement in my first and second attempt was that of medical science. I thought that I have not been able to clear the main examination because I was weak in medical science, which was actually true, but I was also weak in the GS part. So I only improved my medical science. In fact, it was a huge jump for me, and I neglected my GS, and I paid a heavy price for that. As and when, because there is one problem with the system of the examinations. Only the results of main examination come in the month of October or November, but you do not get your marks. So you're not able to strategize for the next 4 to 5 months. It
What?
is, in my opinion, a
Yeah.
lacuna of the system, so to say, but it is what it is. Then, when I got the marks of my second attempt, I realized, okay, I have overcompensated for the medical science for the GS. So I have to achieve that balance, which is so much required in the preparation and the career as well. In the third attempt, I also made some changes in my preparation. I went to Delhi, I joined some good classes, I took some mentorship. I also joined the test series and wrote some tests, both of GS and medical science. And that somewhat helped me to at least get into the list, and I got into railways last year. But I was like, I have much more in my mind for myself, and I can do it. I still had that potential, so I appeared again. I this time wrote even more tests of medical science. You know that's then I wrote some tests of GS as well, and I especially found out my mistakes and worked upon them, and apparently it has paid dividends.
If there is a similar aspirant who is kind of aspiring to become a civil servant and giving his multiple attempts, maybe 2 or 3 attempts, like how will you put all these things into a single sentence or a phrase? Like what should be the thought process change that you need to bring in to be able to be successful in an exam like UPSC?
So that one sentence would be, uh, there has to be that attitude that I have to learn from my mistakes instead of blaming the system and everything else except myself. There is this dialogue, sir, which is close to my heart. जब तक तोड़ेंगे नहीं तब तक छोड़ेंगे नहीं. So you have to really focus and put all in, and even after that, if it does not work out, if you can honestly say it does not, I put my 100%, still it is not working out, then it is fine. Then you can rest your case, but not before that.
I think I would like to add a few things here because uh, I constantly get calls from students. Uh, I very rarely talk to toppers. Like this would be the last time you'll be interacting. You'll be very busy with your services, right? But I'll be talking to those students who want to give their next attempt, and there is this hashtag restart and persistence which is trending with UPSC. So what I would believe is, as in your case, you're not just persisting, but actually you're working on improvements, and it's very good that the good quality I have noticed in last few years of traveling with you through UPSC journey is that constantly you're trying to improvise and work on your mistakes. You're not blaming anyone for that because this is the same scenario of 4 attempts. If medical science students, like if 20 medical science students on a hypothetical basis, if they go through this situation, the first thing they blame is optional, because you can only blame optional in UPSC journey. The only thing which you can change in UPSC is either you have to shift out of it or you can change optional. Otherwise, everything is static. I think, right? So that way, instead of students spending energies on improvising the GS part, they run after different optionals to master it. And that mastering itself takes their valuable time. So when they come back again, they might score good in a scoring optional, but at the end of the day, the GS will definitely take a toll on them. Right? This is what I observed. Like and the change you have brought in. Because even I was amused that you have sent me your scorecard of 2022, that was 273. The next immediate message was, sir, how to cross 280. Then I thought, this this doctor has almost 8 months or 7 months of time to improvise on medical science, but still he's so optimistic. Then I thought you understood the essence of the exam. The balance is very important. In the first attempt, you scored around 213 medical science optional. In second attempt, you scored around 277. So this is overcompensation. To overcompensate, the brunt of attack might have fallen on GS. This time you realize many of the toppers in last 2 to 3 years, they are above 280. If you get into that zone, I think you are aiming for that safer zone. So this is what I tell all my students. Like, this is law of average exam. You have to score above average in all aspects of UPSC. If you are master of medical science, you will become Dr. Navin and you'll teach people, right? You won't become a civil servant. So you'll stay with medicine. This is what I tell my students. And you have a real live example for that, right? This is the best way I can put forth, right? So they just, uh, ve- uh, I'm very happy to know this because uh, this might look simple or silly, but in the long run, as we go along in 5, 6 years, many of the students will be watching this video and it will be a very good lesson for them because experience has taught you this. But they are lucky that we both sitting here and teaching them this experience. If at least 1 out of 10 doctors, if they understand the essence that it is a game of balance, don't start. Yesterday one of the student called me, sir, I got 2 gold medals in final year. I'll get 330 in my medical science optional. Now you train me. So this is what I say, over enthusiastic approach towards optional. Then I told him the topper who scored around 1100, he got 308 in optional. Okay, so you have to be optimistic with the optional. So very good. And next, there are some students who are starting their journey in the initial stage of their preparation. What advice would you like to give them about medical UPSC? Yeah.
So, the first thing is having the right expectations. Most of the people of our generation lack the patience which this exam so severely demands. So 1 year of examination and 1 year of preparation, bare minimum of 2 years of your life are required to seriously prepare for this examination. Second, imbibing the right qualities. Like for example, if unfortunately you're not able to sail through this examination in your first go, have that perseverance, keep fine. Uh, you may or may not have the backing of your family, financial backing, 100 different things can come as obstacle in front of it, but you will sail through, you will improve, and you will continuously keep on improving towards it. All type of people after all compete and clear this examination, right from poor to rich, urban, rural, everyone. And sir, third would be getting a feedback, and it can come from a mentor like yourself, senior like who has already cleared this examination, someone from your family. But you have to continuously assess yourself. Okay, since last 2 months I've been doing this thing, is it going in the right direction? Because in the absence of that, the feedback is actually the result of the examination. After 1 year you realize, okay, whatever I was doing was not right. So if we do it by ourselves, like every 1 month, 2 months, 3 months, the pain of the process will be considerably reduced and the time will also be reduced.
Hmm. Very well said. And what was your plan B? Right? Were you planning to give next attempt, or were you thinking in the lines of something else?
So in the first two attempts, there was no plan B. I was fully and 100% focused upon clearing the UPSC. The first instance where I seriously thought about, okay, whether I am made for this or not, was after I did not clear my last attempt. So I got into the list, sir, but it was not in the main list. I got into the reserve list.
Sure. Yes, sir.
So I was really hoping that I am getting into the list, but it was quite a heartbreak. So I thought, ki even after putting so much effort, maybe I'm not made for this. Maybe it is time to shift back. And at this time, these are the real lows of your life. Your support system comes into picture. Like I have a very good support system of my family, my little brother, my friends, some of the close ones. I could even discuss some of the pain points with my teachers, including the medical points with you. So the core system has to be really strong. It pulls you up from that low, and even the I think the Almighty sees that, okay, this particular person is putting so much effort, let us reward him sooner or later.
We'll switch to the medical science preparation and strategy, and what advice would you like to give? Because yours is the second highest mark this year, right? From 230 few years back to reach to a stage wherein you got 284 this time, right? Paper
Yes,
1
sir.
140, paper 2 144. So talk us through your journey, and in the journey, what advice would you like to give to medical science aspiration students who are struggling with two things? One is over expectation, other is optional dilemma. Please.
Sir, I will like to be really honest and put the second question first,
Yes.
because this thought used to always cross me just before writing the optional paper, that did I take the right decision of taking medical science as an optional subject when I have to read so much, revise so much, remember so much. But then I realized that I have already invested so much into this that even if I were to think about this, it should have been thought during the initial phase of my preparation. Now I am deep into it, and really am not going to change it. Plus, I have been rewarded for my efforts, sir. I have been consistently getting 270 plus marks, and every year with these kind of marks, medical science people are getting into the top services. So that doubt was resolved from my end. But again, for the fresh aspirants, it is a choice they have to make. How good they are, do they think they can handle the pressure? It is, in my opinion, a very personal choice they have to make. If they have made the choice that the medical science is their thing and they are going to invest into it, then I have a very blunt opinion. If you want to save your time and save your efforts and sail through this examination in the least amount of attempts, then you should join a coaching, because it is basically acting like a catalyst to this reaction, sir. You can do without it perhaps, but it will take a lot of time and effort. It is not just worth it if money is not an issue. And that is why whoever asked me, I simply referred that okay, I have joined this particular coaching for medical science. It has definitely helped me, and otherwise I will have to start preparing for that since my second year, at least second or third year. I will have to keep on building my notes. Doing that after the internship is over or during the internship is a very tall task in my opinion, sir.
Yes. And uh, what is the changes you brought into your answer writing as you go through the process of medical science, right? So in the optional part, what I could see is for even minimal marks improvement, you have to make a major shift in presentation part. So I could see people with good concepts and good content also not scoring well, but people who were drawing images, flow charts, algorithms were able to perform better even in the mock test what we conduct, and even when I analyze their papers once they get their top marks. So even I was surprised. Like, he got very good content, but still he was getting less marks in comparison to the student who is giving less content but better presentation. So during our university exams, as you have started saying, this is not at all competitive, and even I did not draw many images during my theory exams in universities, right? So, what difference you have brought into your medical science answer writing?
There are a lot of differences actually, like the general things which usually a serious aspirant knows: drawing more diagrams, more flowcharts, adding in the IMNCI part in the pediatrics, adding in the WHO guidelines, putting in those diagrams even where it is not needed, but adding some value, then hitting to the exact demand of the question, having that clinical mindset. Like first there is a history, then there is clinical examination, then investigation, then treatment, and even in that medical surgical. So in fact, I could definitely say there is a video of yours in which you talk about all these things.
Yeah,
That
what?
is actually a very good investment of time, which you had just discussed before main examination. And so second thing is, how did we learn? How do we come across this? And these are the things which are actually getting rewarded in the UPSC journey. Is the toppers copy. Toppers copies are the best source of these nuances of presentation, of creative diagrams, of uh, basically presenting your paper in such a way that whatever knowledge you have is in the best way visible to the examiner. So toppers copies and help from mentors like you.
Yeah. Let's shift into the strategy for prelims because we were having previous discussions like CSAT is becoming unpredictable, but I don't think you ever had such a big issue for clearing prelims because in last few attempts you were with a good margin you were clearing prelims. So what was your prelim strategy? Then we go to the GS. Then The interview part, yeah.
Yes, sir. As you pointed out, I have cleared prelims 4 times in a row, and sometimes I used to brag with my friends that even if the UPSC conducts this exam 4 more years, I'll clear it in the next 4 years as well. Because, sir, there are two, three things in my opinion which are key ingredients. Number one is the knowledge base. For GS and especially prelims, there is a static part of like 60, 70 questions, even more than that, which is the bare minimum and it's there every year. So the subjects like economics, polity, science and tech, environment, which garner like a lion's share of the whole process. I had a very good static knowledge about it. My basic notes and basic understanding of the knowledge, basic understanding of the subjects was very good. And you will find, sir, like there are many aspirants like me who will successively keep on clearing the prelims examination because they have a very good understanding of the basics. Second part is the judgment of which questions is to be left, which question is to be attempted, and which question is to be taken care of using logic, elimination, etc. That logic is built up in me because I have been an aspirant since my school days who has taken a lot of MCQ examination, competitive examinations. That can also be built even if you are coming from a humanity background by giving a lot of mocks and doing your self analysis like where did I go wrong, why did I mark this question as wrong, was I not focused, was I uh, very anxious, or was it my logic useless logic. So this self analysis actually is required for not more than 5 to 6 tests, sir. Once it is built up, then it is just a process of further consolidating our knowledge bank by using both static and 1 year of at least 1 year of current affairs, and keep on sharpening our logic. Using this, sir, usually I have come across very good accuracy. So I have always scored 100 plus and at times 120, 130 plus. So I used to attempt more like at least 80 questions. Even if the paper is very tough, minimum 77, 78 questions, out of which an accurate accuracy rate of 60 plus will definitely land you into that 100 plus zone and you're more or less safe. It has also an added benefit, sir, that after the prelims is over, those 15 days until the result is come, you are more or less at peace of mind and you can focus fully on preparing for the main examination.
And
So
this time
that
it
is
is
the
even
prelims
more
time.
important because students are already losing 21 days of their preparation cycle because of the exam.
Yes, sir.
So it's just unpredictable. And is there any special thing you did for CSAT, or because during your times of last 4 years itself, there is a
True,
rapid change
true.
in the pattern of the CSAT. There's more and more, they say IIT level maths, they say, right, into inculcated into the CSAT part. So how are you handling that?
Sir, I made a conscious choice in between the paper. This is what I mean to say that UPSC does not just check our knowledge, it checks 17 different things. One of them was in this particular paper, your temperament or your common sense. During the paper, I realized that this is a very, very tough paper, and I am usually good at mathematics and mental ability. If I am finding it difficult, then it must be really difficult paper. So I shifted mid course to comprehension. And only by clearing the comprehension, there are around 27 questions, 26, 27 questions of comprehension. If you get like 20, 22, 23 questions correct, you are more or less settled and you just need 10 more questions out of the 53 questions. You will, you need not even attempt the rest of the questions of the mathematics. I think that was the only way anyone without, say, mathematics optional could have cleared that paper, this year's paper. So
Is there any way that even the comprehensive questions can be like the standard of comprehensive questions can also be made at tough? Is there any chance of doing
that
that?
is 100% possible, sir. Like UPSC can play that trick next year. And then we will perhaps have to check the other section around. They may make a particular section very easy so that the aspirant, uh, by the time he reaches this question, the time is almost over, and that kind of mind games and tricks can be played, sir.
Hmm. So I was thinking that because comprehension is the best way for a doctor because we do have that common sense of like going through these things. But again, it is very well said, but you have to prioritize your comprehension preparation more than the mathematics part just for the time being. You have to also follow the analysis of every year paper, like how the trend, what is the trend gonna be the next year, right? So just quickly talk us through the GS resources, what you have used and what was your strategy.
So for GS, my resources were pretty scattered because I did not have a particularly good foundation class in one class. in one coaching institute. For GS1, I used to take lectures of Pratik Nayak in history, lectures of Himanshu Sharma for geography. Then the basic sources are always there, like Spectrum, NCRTs. NCRTs are the one we start with. In case of society, I used to take lectures of say vision notes. In GS2, M. Puri sir's notes. Then in international relations, some current affairs here and there, and the newspaper reading. Again, newspaper reading is very vital and continuously adding value to all these subjects day by day. For GS3, I use QEP Quality Enrichment Program of ISF Institute. For GS4, again, I used the same institute program. For medical science, I was more or less dependent on just two people. One is you and one are my parents. So both of them are doctors. So I used to get benefit of both of them and you, sir.
Yeah. So talk us through your interview experience, and is there any questions about why UPSC for a doctor or any health related questions?
Yes, sir. This particular question was asked of me this year, and it is a very standard question they ask of doctors. Why do you want to change? It can be framed in 10 different ways,
Yeah. Yeah.
and I have a very honest and I think very robust answer to that. It is that doctor has one of the noblest job, and it has its own positives and perks, but it has the limitation of scale, which I found during my government days. And I found that working as a civil servant gives you that scale. You work on a whole different level, affecting thousands and lakhs of people's lives, directly, indirectly. Yes, the doctor has the satisfaction of saving that patient's life, that personal connect, but I was more into the social service at a grander level. And there is, I think, only two ways in India we can do that: becoming a politician or a civil servant. And I simply do not have the temperament of politician. I am more suited to be a civil servant. So this is my path.
Maybe in the future, right?
I do
Parallel
not know.
thinking. Yes, because most of the times in the family, if there are parents or doctors, like they lay a very good foundation for you to flourish in the medical segment, right? Definitely. And vice versa happens with aspirants who have civil servants as their parents.
Yes, sir.
So, but yours is a different case wherein already there are two doctors in the family, and now, like, what were your parents' thought? Like, do they know about this switch, or how are you able to convince them to shift your career option?
So, sir, in the home, there was a difference of opinion actually. My mother wanted me to become a doctor and pursue medicine, but my father was of the opinion that, okay, this is not very hard and fast, that we have built a hospital and built a setup that now you have to run it. uh, we did it on our own. They are the first generation doctors, and you do your own thing. In fact, he was a little bit more into pushing me for civil services. So ultimately, both of us convinced our mother, and by the time I started to prepare for civil services, even she got convinced, like, okay, let us go for it, because I wanted so badly to be a civil servant and all. Uh, Now, even when I did not succeed in my first two attempts and I was at my rock bottom, these were the people who pulled me up, like, okay, we know, we see your hard work, so it's okay, let us continue it. So that is their opinion about me changing this path. There was some initial resistance, but more or less it was done with when I put my 100% into it, and then they supported me like any good parents will do. So yeah, that is their takes.
So frame it in a simple sentence, your secret for success.
Okay, that is a tough one. Sir, I will again stick to my basics. uh, Go for the kill 100%, but if you cannot achieve that, learn from your mistakes. That will be the one line. Sir, I think at this stage I am just grateful for whatever is happening. It is actually a little bit more than I can take, that it is still sinking in. And I am just trying to remember all those people who have helped me in my journey, and trying to be grateful to them by meeting them, showing them that, okay, I remember that whatever role you have played, and trying to help those aspirants who are in need of some kind of guidance, because I see myself 3 years, 4 years down the line in those aspirants. So if I could save like 1 or 2 years of their lives, then I think I have uh, paid back what was given to me by my seniors, my mentors. So That is the feeling right now.
Let's keep in touch, okay, whenever possible. And also, we
Yes,
do
sir.
have some interview guidance programs, okay. If time permits, once you're free during your training period, okay, we'll definitely uh, have a session about the interview guidance to the future aspirants.
My
Okay.
pleasure, sir.
Yes. Signing off. Take care. Yeah.
Thank you, sir. Thank you so much.